Hi everyone, NervGen just updated us with a ton of new news on their spinal cord injury trial. It is packed full of information that will go right through, strip away the hype from, leaving us with the real recovery facts, hopefully before the mass media screams cure again. I'm your host Mike, welcome back to the channel, and let's get straight into it. This week, NervGen just released its latest comprehensive results for the treatment of spinal cord injury with its NVG-291 drug. Today, we'll cover the very positive recovery numbers, the news on the newly named Phase 3 trial, plus the ifs and hows one can apply, and we'll even reveal NervGen's next-generation pipeline drug, NVG-300. Ready? Okay, let's get the mission behind NervGen's treatment understood. When the spinal cord is injured, the body rushes to protect the area, and in doing so, forms what is termed a glial scar. It's a protective mechanism to stop further damage spreading. But this scar is a double-edged sword in that although providing protection, it unfortunately also acts as a brick wall to nerve growth. One of the key ways this scar blocks recovery is through molecules called CSPGs, short for chondroitin sulfate proteoglycans. These are naturally present in the central nervous system, and under normal conditions, they actually help organize and stabilize healthy neural structure and function. So they are not bad molecules in normal functioning. The problem is that after spinal cord injury, they become heavily upregulated around the injury site, meaning there are many more CSPGs than normal, and they become a major part of the glial scar environment. To understand how NVG-291 works, we need to look at how those CSPGs do their damage. They signal by binding to a receptor on neurons called PTP sigma. Like a key in a lock, when a CSPG binds to a neuron's PTP sigma receptor, the stop pathway is activated, keeping neurons in an inhibited state. That is, the brakes stay on. Enter NVG-291. It is a peptide given via a daily injection under the skin. It's designed to interfere with the neuron's PTP sigma receptor. It acts to block that PTP sigma receptor from being able to work, so it can no longer send a stop signal, regardless if bound to CSPGs or not, releasing the brakes and allowing the nerves to sprout new connections, regrow, and possibly repair. Great. Now we understand how NVG-291 has been designed to work. We can move on to the newly released results on how well NVG-291 treatment did in its Phase 1 to 2 trials, as well as look at NervGen's next big Phase 3 trial coming soon. A quick recap. The NVG-291 trial, called CONNECT SCI, started in 2023, and it finished enrolling in early 2025. NervGen described the chronic CONNECT SCI study as a 16-week placebo-controlled trial with 12 weeks of daily NVG-291 given or placebo, followed by a 4-week observation period. And in their trial overview page, they now explicitly say the chronic cohort trial is completed. Top-line early results from the trial were posted in June 2025, which we reviewed in the earlier video. And just a couple days ago, on April 7th, 2026, NervGen have released their main results. The early results we reviewed from late 2025 were great, but the expanded data that was just released is unprecedented. The first big headline is they recorded an 825% hand function improvement. The trial was on people with chronic incomplete cervical level injuries. That's people with neck injuries with some movement still present lower down the body. The trial measured hand and arm use using an FDA-recognized scale called GRASSP. And it's in the updated data that NervGen revealed a big 825% improvement versus the placebo group in functional hand use. Now, whenever you hear a percentage that dramatic, it is important to stay grounded and remember that percentages can sound huge when the placebo group changes very little. But even with that said, this is still one of the standout results so far. As for someone living with loss of arm and hand movement like many of us, getting hand function back means regaining the ability to feed yourself, groom yourself, and basically move much closer to independence in basic tasks. It's a massive quality of life upgrade. As well as this, NervGen reported that NVG-291 significantly suppresses what scientists call maladaptive reticulospinal hyperactivity, which means the crossed wires in the nervous system that cause violent shaking, rigid posturing, and uncontrollable leg extensions were calmed down. Many of us with SCI know how painful, disruptive, and inconvenient muscle spasticity and nerve pain can be. This is important because if you are trying to promote useful repair, you do not want to create chaotic, uncontrolled activity. So seeing signs of reduced hyperexcitability is a great positive signal. Another test is durability. A true neuro repair drug shouldn't wear off the second you stop taking it. NervGen reported long-lasting durability in their follow-up findings. Recovery effects persisted long after the main treatment period, in some cases up to 364 days after the trial ended. Next, we have the patient qualitative interview data. And before I read it, it's worth keeping in mind data, that these are patients' own reviews, which are really important, but to science methods, they are not formal primary endpoints, so they should be seen as encouraging signals rather than definitive proof on their own. But even with that said, the findings were really good. For example, 67% of treated patients reported distinct improvements in voluntary bladder control, compared with 22% on placebo. And 75% of treated patients reported being much or very much improved overall, compared with 33% on placebo. So while these are not the same as a hard primary outcome measure, they are real-life participants who felt meaningful, real-world changes that lasted beyond the dosing period. So what is the next thing from NervGen the scientific and SCI communities are waiting for? Well, one of the final pieces of information still to come from CONNECT SCI is the gait analysis, which roughly is a fancy way of saying walking ability. NervGen has said it is preparing a gait analysis from the chronic group. This matters because proving walking improvement in research is difficult. A person can sometimes look better because they have simply learned a new compensation strategy. For example, swinging the hips differently or using momentum in a smarter way. So NervGen brought in an independent, specialized motion analysis group using multi-camera biomechanical assessment to look in a more objective way at how people were actually moving. This is why it's a little bit later than the rest in being reported. And that is everything from the complete trial data, bar the gait results. So we just discussed the results of chronic group who were in the phase 1B/2A CONNECT SCI trial, which ran 2023 to 25/6 and has now completed. And that leads us to the big next step, the upcoming phase 3 NVG-291 trial. The next chance to access the treatment is this upcoming phase 3 registrational trial, which has just been officially named RESTORE. NervGen is on track to initiate this across up to 60 sites in the US and Canada by mid-2026. But remember, trials are nearly always very specific on what type of injury they will target. So to be considered, you'll need to fit the exact type of injury they are targeting. Their plan is to enroll approximately 150 subjects aged 18 to 75 with chronic tetraplegia due to traumatic spinal cord injury. You must be 1 to 10 years post-injury, and most importantly for most of us, your injury must be neurologically incomplete, classified strictly as AISC or D, which rules me out. The FDA agreed that the main goal of this trial will be measuring improvements in functional hand use at week 12. There will also be a placebo group, but importantly, NervGen says the study includes an open label extension. That means if you were randomized to the placebo group, you may then have the opportunity to receive 12 weeks of the real NVG-291 treatment after the blinded portion ends. Can anyone apply for this for the phase 3 trial? Well, potentially yes, as long as you meet the criteria, and once the trial is officially listed and recruiting at sites. You do not need some special insider invitation. Normally, once a study is posted and centers are active, you or your clinician can contact a listed study site and ask to be screened. So for mainstream entry, the main thing to watch is the RESTORE trial listing once it goes live. Later in the video, I'll give you my workflow on applying or watching for this or any other trials. An important factor in SCI research is funding. It can make or break research, and unfortunately, as we all know, money makes the world go round. And to pull off a massive global phase 3 trial, a company needs a lot of capital and serious corporate firepower. And NervGen certainly know this. They have been busy making their company well positioned for funding big projects. In March 2026, NervGen delisted from the Canadian TSX Venture Exchange and consolidated onto the US NASDAQ under the ticker NGEN. They also appointed a powerhouse team of executives, including a new CEO, Dr. Adam Rogers, who is shifting the company from early-stage research into late-stage FDA negotiation and global commercialization. What does this mean? It's a great business funding strategy. NervGen having a US NASDAQ listing, it usually gives a biotech company far better visibility, credibility, and access to larger pools of specialist investors. while stronger late-stage leadership makes investors more confident the company can actually deliver a phase 3 trial and navigate approval. And hopefully, bigger investment with more potential investors filters down to new research for us. Okay, if you've gotten this far, well done, as now we'll end with the most fascinating piece of information I came across, the next drug in the pipeline, NVG 300. For a few years now, the company has been working on a next-generation candidate called NVG 300. Unlike NVG 291, which is a peptide, NVG 300 is described as a biologic molecule, which is a medicine made from living cells. The company says it is aimed at similar neurorepair biology, but with broader condition potential. NervGen has discussed preclinical work connected to more severe models of spinal cord injury and ischemic stroke. It had also mentioned ALS work previously, although they appear to have paused the ALS work rather than pushed forward all at the same pace. Another interesting detail is that the company says it has already developed a high-concentration liquid designed for a pre-filled syringe, which suggests they are thinking early about practical self-administration and manufacturability, not just the biology. That said, NervGen has not announced any human trial start date yet for NVG 300. My own guess is that the company will stay heavily focused on pushing NVG 291 through phase 3 first. So personally, I would not expect NVG 300 human trials immediately. If I had to guess, maybe later 2027 or beyond, but please take that with a huge pinch of salt because that is me speculating, not reporting confirmed news. So where does all this leave us? We saw the confirmed completion of the NVG 291 trial, the measurable gains in hand function of the chronic incomplete patients, long-lasting effects at least up to 1 year after treatment, as well as the participants' own self-reports that they felt they improved a lot in their quality of life. We now have the upcoming RESTORE Phase 3 trial, and to top it all off, the emergence of a next-generation biologic in NVG 300. NervGen has clearly positioned itself as one of the most closely watched companies in spinal cord injury repair right now. Hopefully, there will be more great news to come out of NervGen in the future. But before we go, I want to answer the practical question on when is the Phase 3 trial and how to apply. First, a quick disclaimer. I report on what I research and try to stick only to the facts as I understand them. I'm not an expert, and I absolutely can make mistakes. So please use me as a jumping-off point, not the final word, and always speak to proper healthcare professionals when it comes to real medical decisions. That said, as a practical roadmap to applying, this is what I do. When NervGen officially launches the trial, and as of today, the 10th of April 2026, it is not yet listed or recruiting, but they should register it publicly mid-2026 sometime. The first place to find it is likely to be clinicaltrials.gov. The following is what I do. Head to clinicaltrials.gov and search for NervGen or NVG 291. Look for the trial labeled Phase 3 or RESTORE. Look for when that says Recruiting. Scroll down the trial page to the Contacts and Locations section. It will likely list every hospital and rehab center participating in the trial, usually along with the direct phone number and email of the study coordinator. At that point, if you appear to fit the criteria also on the trial page, you or your doctor can contact the site directly and ask to be screened. Additionally, you might also keep an eye on SCI Trials Finder site, linked below. They post the same trials from clinicaltrials.gov, but personally write clear trial info, as the government site trial listing can be sometimes a little confusing. Anyhow, I highly recommend bookmarking both of these sites, and I'll put direct links to all of these resources, including NervGen's official updates, down in the description box below, so you can stay one step ahead. Okie dokie. That, my friends, is everything I know passed on to you. As always, if you think you got any decent information from my research into NervGen, please let me know with a like and subscribe. It really helps in reaching more of us, and I shall do my best to keep you updated with the latest and greatest in SCI research. I will be back to report on any further updates and new research news as it comes. Until then, stay well, and I'll see you in the next one.